Welcome to today's COVID-19 update. I'm Felicia Valenzuela, and we're speaking with the Honorable Minister of Health, Dr. Frank Anthony.
Well, thank you very much for having me on the program.
Good, welcome. So, firstly, let's start. I know there's some exciting news for our local doctors. There is to be a specific training for COVID-19 for them. Could you tell us about that?
Well, we had a meeting with the ambassador of Chile to Guyana, and one of the projects that we're working on is to train clinicians in Guyana. So, from the 2nd of November to the 20th of November, there will be specialized training that would be offered by the Chilean authorities on the management of COVID-19. It's actually a very extensive course looking at different aspects of COVID-19 management. So, how do you detect the signs and symptoms, what to look for, and then, of course, how to do ventilatory management and other complications that would arise from COVID-19. That course is expected to run from the 2nd of November until the 20th of November, and it would be done virtually. So the faculty would be in Chile, but participants can be in any part of the world. So we are very happy for this collaboration, and locally, I have reached out to the Guyana Medical Council, and they would be working with us to ensure that the information is circulated to all doctors who are registered with the Medical Council. And so literally anyone can participate in the training program. So we are very hopeful that the local doctors would take the opportunity of participating. And I think it would be providing the most up-to-date information on how to manage patients with COVID-19.
Is there a limitation in terms of space?
No, because it's done virtually. I think quite a number of persons can be on the platform. So we expect maybe about 200-300 persons participating from Guyana, and I think they can accommodate that.
I know this, of course, adds to training generally across the board. During this week, the mental health training for health workers also started.
Right. So we had mental health. Now we're looking at upgrading people's clinical skills, because the challenge that we have with COVID is that almost every day there are new information coming out, new things are being discovered, and with all these studies and trials that are being done, we are learning so much more. So unless we are constantly reading and updating ourselves, we can easily be left behind in terms of knowledge. So when we have courses like this, the professors and so who've been tracking this thing on a daily basis, they're able to pull all the pertinent information together and to be able to present it, in a comprehensive course. And that's what you'll be getting when they join on the 2nd.
All right, Minister, thank you. Going now from that to international news, where the remdesivir, the drug, has been approved in the U.S., and then secondly, there's the treatment, the plasma treatment. It's showing little benefits. Our question to you is, how does that impact us in Guyana?
Well, we've been using both of those things in Guyana. Remdesivir we have introduced probably about a month ago, and we are using that with our severe patients, persons who are in the ICU. There was a study that was done earlier with remdesivir, and it had shown benefit for a very specific category of patients. And we have tried in our guidelines to use it on those specific patients. So I don't think and after this, after we have started to use it, we have then seen maybe about a week ago that the WHO published preliminary data with a larger study that shows that remdesivir did not have much of an effect. Now, in the first study that was done, basically what remdesivir was doing, or what that study found, was that if the duration of the disease normally takes about 15 days, then remdesivir would shorten that recovery period. So in a lot of cases, it would be about 11 days on average. And so there is that benefit. And that's why it was used, because rather than have people with this severe form or critical form of COVID, if you can reduce that time, there is that benefit to persons. And so that was from that very first study, and that's why emergency use was granted for remdesivir. With the largest study that was done by the WHO, they found that there wasn't much of a difference. But that was published in what is called a preprint, an article with all the details, the findings, the whatever that they have looked at. That should be published very shortly in the New England Journal of Medicine. So when that is published, we'll get better information to work with. But the US FDA, which is the regulatory body in the United States, initially had granted to Gilead an emergency use authorization for remdesivir in the US. And that's how clinicians in the US was using it. So what they have done now is to move from an emergency authorization for the use of remdesivir to treat COVID-19 patients to one where now they're authorizing the use. And that type of decision is not taken lightly. They would have had a lot of other clinical information and information done from various studies before they would allow such use. But again, once the scientific data becomes available, I'm sure our clinicians here would look at that, reevaluate our treatment protocols to make sure that it's updated with the best science at our disposal. So I think, they were the clinicians that are managing our guidelines. They have been looking at some of these things, and the updated version of the guidelines would reflect the latest scientific thinking. So let's see what happens. The second thing, dealing with the convalescent plasma, I know recently there was a study that probably showed not much effectiveness with convalescent plasma. But again, it depends on really what we are looking for. Convalescent plasma, as we know, would have antibodies, and they would be harvested from persons who have recovered. Again, it's a little imprecise because we are assuming that everyone that recovered from COVID would have had a high titer of antibodies. In some cases, people who recover, some of them might have a high titer of antibodies, others would have a lower titer of antibodies. If you take convalescent plasma from those that have very low amounts of antibodies, then obviously the effect of that when you give it to a patient would be much less than if you take from a person who have higher levels of antibodies in their system. And I guess, again, we have to look at the way that this study was done to really ascertain, why they are finding this, and if this is the, how can we extrapolate from these findings now into our clinical setting. So it's good that we're getting so much study. It's good that new information is evolving, and because new information is coming out, we'll modify and change our practices. But I know that was one of the challenges that we were having with convalescent plasma, and we'll have to see the latest information and then make decisions on that. So, yeah, and it's good that we're learning more.
I know that you had mentioned earlier, as part of the education campaign, you had noticed persons weren't really adhering to some of the protocols, especially within the markets. And we know that at Starbrook, there is going to be a tent set up, a COVID-19 test. Could you update us on that?
Well, I think during Operation COVID Curb, we have single out in a way a lot of these markets because we recognize that people were not compliant. And we also realized that at a lot of the minibus parks that people joining the minibus operators themselves were not complying um, with some of the guidelines. And so during the last couple of weeks, as we go out and we interact with people and talk to them, we are recognizing that maybe instead of just going periodically, that we need to have a more permanent presence in some of these areas. So through the Ministry of Home Affairs and really through Minister's Ben initiative, um, he has decided to pilot this tent in the Stabroek Market area. He went out there with a team, spoke to some of the minibuses and the people who would use the minibuses and so forth. And also he has talked to some of the vendors and things like that. And hopefully we'll see now maybe better compliance. I think with the people that they have spoken to, while we might be providing some of the things like tents and so forth, they would be operated more or less jointly between the minibus operators and some of the people who do their business around the Stabroek Market area and agencies of the government. So that is the kind of collaboration that we're looking at, and we'll see how this goes. If it works very well, then we'll want to adapt some of the things that we would have learned from this and use it maybe in other areas.
All right. Minister, I know that hospitals in the outlying regions, and health centers, they're still in the process of retrieving their ventilators and so on. But just to ask you, how has it been going with them? I noted when we spoke the last time, there was a bit of a spike in Region 1, but your health teams were on the ground. Just a general update, how are the regions doing?
Well, I think as I said before, we constantly monitor what is going on in the regions, and every day we basically get an update. And wherever we see spikes in cases, we try to come up with a response of how we're going to effectively deal with those spikes. So that has been an ongoing engagement that we have with the team that is centrally located and with the regional teams. So every day they do these analyses and then come up with a response plan. So that would be ongoing. In terms of the ventilators themselves, we have been deploying to the region. A number of regions have collected theirs, and others would be uplifting theirs shortly. You can imagine sometimes it's challenging to get a ventilator into some of the interior locations, and I think they're working out the logistics of doing so. And then, of course, we have to send in a technician to make sure that it's properly set up and that the doctors there would know how to use it. So that's an ongoing process. But not all the patients who would be hospitalized would need ventilation care, but we want to ensure that we have it there if it's necessary. And that's why we have given the RHOs a time frame by which all of this should be in their regions, set up, and be available for patients who would need it.
All right. As we wrap up, we know it's Friday, but it's not the end of work at all for health workers, especially. So, is there any particular message you'd like to send to not only our health workers but to citizens of Guyana?
Well, Friday is just another working day for us, and we work very actively on weekends as well. But that's the nature of what we do, and we're here. Basically, the whole system is at the disposal of the nation because we want to protect people's health. The general population can help us by working with us, taking the precautions so that we can reduce the amount of cases that we have. And again, because older people are more vulnerable, we want the older people to take that extra precaution. We want people who know that they have underlying illnesses to also take precautions. So those persons who are diabetic, those persons who are hypertensive or have cardiac diseases or any one of those ailments, that they too should take special precautions. We know also that persons who are immune system have been compromised, so persons with diseases such as HIV, that they too need to take additional precautions. So basically, if you have an illness, an underlying illness, whether it's infectious or chronic, you need to take these additional precautions because you are at an additional risk. And if you take the precautions, then you're protecting yourself. So we really want to appeal to people. We have seen that those who have taken precautions are doing much better. They've been able to protect themselves from the virus. And if you don't take the precautions, then you can get infected. So please help us to help you by taking the precautions.
Well, that's it for today's COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms. Thank you.